Hey there, Pastor Greg here. I wanted to give you an update on my Achilles injury. Had some developments since I last spoke to you on Saturday, just a few days ago. This is video number 2. Recently, I just went to the doctor on Monday, and it's 2 days ago. I was able to get in to see an orthopedic doctor, and he gave me some news about my Achilles, and I was very hopeful. Found out that it turns out with the things that I had been reading and even researching and even other videos that I've seen, as far as the post-operation recovery and that sort of thing, is different with his office. They found new research and new surgeons and that sort of thing, and so I had read that there would be a 30 to 40% chance of re-rupture if I didn't do surgery, and a 3 to 4% chance if I did do surgery, and so he'd said that there's actually a 1% chance of re-rupture if you do surgery, and a 10 to 15% chance if you didn't do surgery. But they have found out that if you start moving the Achilles sooner after surgery, it leads to a faster recovery. And so instead of being in a cast for 4 to 6 weeks and changing a cast every week, being on crutches for that long, it's actually only 10 to 14 days on crutches. And then in a walking boot, and doing physical therapy and back to normal kind of activities within 6 months. And so last time I talked to you, I kind of had this crisis of faith, if you will, being a man of faith and believing that God is able to heal and God wants me well. Trying to figure out what to do in this situation, and I've had to kind of step back and ask God, what do you want me to do? And I know that He's in this whole thing, because on Monday I was trying to do things on my own, and I had got a recommendation for this doctor, and the office opened at 8 o'clock, and it was 8:30. I hadn't gotten a call yet. I woke up early, and I was ready to kind of get things done and get into the doctor's office on Monday, make a same-day appointment, and that's almost unheard of. But I didn't receive a call yet, so I began making phone calls. I called this doctor's office. They said, he's not available until the 14th. He's not even really accepting new patients. And I said, oh no, so they tried to put me in a different doctor, and I wouldn't see him till Friday, and so I got a little frustrated. I got off the phone. I called the doctor who did my knee surgery 4 years ago, and he doesn't do this type of surgery, and so hung up with them, and called another doctor that was recommended, and they couldn't see me, and the guy was kind of a jerk, and I said, I was like, no, that's not going to work. It would take another week, and so here I am, frustrated. I'm about to make a Facebook rant, about all my frustrations, and find out I get a call right then, and they said, hey, we got an email. This is Dr. Hunt's office. We got an email. We got a text message saying that you need to see us today, and this is the appointment that we have. So I was like, yes, let's do this. So went there and saw him, and then he recommended surgery, and so opted for surgery. I'll be going into surgery here in a couple of hours. Very hopeful about the recovery. But one thing I wanted to share, maybe you found this video because you injured yourself and you're trying to figure out what's going on. And so one thing that they did that really helped with some of the pain is they took an ace bandage and they wrapped my calf. And what happens when you tear your Achilles, the Achilles pulls apart from, the Achilles is connected to your calf, the tendon there connects to your heel, and so without that connection, the calf's kind of just, wiggling around doing its own thing, and it's causing a lot of pain. There's no stability there, and so wrapping it just even the past couple of days has helped the pain subside tremendously. So if you've injured yourself, do the Price method, protect, rest, ice, compression, elevation. And one thing I didn't do was the compression piece, and I don't know why I didn't do that, but you should keep it compressed. So when I left you, I was talking about compression for your Achilles injury. That was our babysitter coming, and had to leave to actually go to my surgery, which I just got home from surgery just a few minutes ago, and I'm in bed resting, got my leg elevated, doing that whole thing. I'll show you the cast here. They put me in a splint, which I'm not sure if you can see that. It's a soft deal. they did a nerve block on my lower leg, so I can't feel anything down there, and that'll wear off in 8 to 24 hours, they say. And so I have to be on some pain medication that I'll take before bed. But surgery went well, and be on the road to recovery. They did put me under general anesthesia, and had like a tube down my throat to administer the anesthesia so I wouldn't wake up, and so my throat's kind of scratchy and just not feeling so good right now, but I'll be getting some rest and on the road to recovery. Well, thanks for watching, and I will see you next time.